And we're back. Welcome to Focus and Flow Lectures. Today we are going over COPD, also known as Chronic Obstructive Pulmonary Disease. Imagine trying to breathe through a straw all day. That is what COPD feels like. How about you try it now? Breathe through a straw. Hard, isn't it? For millions with COPD, that's reality every single day. What exactly is COPD? COPD, known as Chronic Obstructive Pulmonary Disease, is an umbrella term describing two underlying diseases known as chronic emphysema and bronchitis. Emphysema causes the alveoli to become damaged. They can lose their shape and retain mucus. Bronchitis occurs when there is inflammation of the bronchioles. This can make it hard for patients with COPD to expel the oxygen that they breathe in, which can lead to CO2 retention. The etiology of COPD. There is smoking, so if you smoke, you have a higher risk of having COPD. There's air pollution if you live in countries or cities such as India, which is a country, or you live in a city like New York or London, you're more susceptible to breathing in lots of air pollution. Next, we have genetics, such as alpha-1 antitrypsin. There's also workplace exposure, where you may have been exposed to asbestos, and here are a few different types of asbestos on the screen. What are the clinical signs and symptoms? A chronic cough, which can have sputum production, such as green, yellow sputum production, for example, which can be as a result of viral or bacterial infection. The patient may be wheezing. They can have shortness of breath, fatigue, and difficulty with ADLs, such as bathing or getting dressed, for example. COPD management. So there's smoking cessation. You can advise the patient to stop smoking. However, it is the patient's decision on whether they decide to stop smoking or if they wish to continue smoking. Medications, there are SABA and LABA, so short-acting beta antagonist and long-acting beta antagonist. An example of a short-acting beta antagonist is salbutamol, and an example of a long-acting beta antagonist is tiotropium bromide. There is pulmonary rehabilitation, so you can do a circuit-based program for the patient specific to each individual, functional exercises, and you can incorporate the Borg scale, which is an outcome measure based upon the patient's breathlessness whilst completing an activity or exercise. Next, you have social support. Can you get support from the family, the caregivers, and any of their friends if they have friends? And then you have education. You want to provide education to the patient so that they understand what is going on. There is self-management and techniques and coping strategies, and you also want to get MDT input, so maybe dietary if necessary, occupational therapy for energy conservation, the doctors, the nurses, if you have like an specialist airways or respiratory therapists. So take action today. Stop smoking. Go and see your doctor if you have any concerns or if anything gets worse. Complete exercise, as exercise can help, but keep it within your functional limits so that you do not overexert yourself. Breathe easier, live better. Thank you guys for tuning in to this video today. I hope you enjoyed, and I hope that you learned something new today. Please like, share, and subscribe to Focus and Flow Lectures. Thank you.